Welcome to the concept of collaboration. The concept of collaboration are exemplars, are interdisciplinary teams, interdisciplinary communication, and chain of command. Chain of command is covered in accountability in Pearson's page 2710. Outcomes. Define collaboration. Define collaborative care in nursing practice. Discuss key members of the interdisciplinary team. Understand the chain of command in reporting problems. Explain the essential aspects of collaborative healthcare. Collaboration is defined as two or more people working toward a common goal by combining skills, knowledge, and resources while avoiding duplication of effort. The goal of collaboration in healthcare is to improve patient outcomes. So that's the goal. So remember that. If we ask what's the goal of collaboration, it's to improve patient outcomes. Mutual respect, true sharing of power and control are essential for collaboration. Ideally, collaboration is a dynamic, interactive process which patients work together with healthcare providers to meet the patient's needs and health objectives. Increased emphasis in nursing community on the value of the interprofessional collaboration and practice to improve patient outcomes. A couple of these standardized collaborations is the American Nurses Association ANA Standards of Professional Nursing Practice. They recognize collaboration as a key component of nursing practice. And then the Standard 10 also is specific to a competency and related to nursing role in collaboration. Quality and safety education for nurses, so that's QSIN. This was a project, for a QSIN project. It was identified teamwork and collaboration as two of the 6 competencies needed to achieve high quality patient care. So collaboration isn't just for on the floor. These are actually standards of practice now and included in both the ANA and QSIN. The nurse as a collaborator. Collaboration may occur between nurses, healthcare providers and patients, healthcare providers from different professional backgrounds, and patients. The nurse as a collaborator. Collaboration may occur between nurses, between healthcare providers and patients, between healthcare providers from different professional backgrounds. Interprofessional teams recognize each individual's professional's value and contribution, atmosphere of mutual trust and respect, and they must have open discussion and shared decision making. Nurses may also be involved in this collaboration, and this develops community initiatives. We can write or revise legislation and conduct healthcare related research. Nurses must assume accountability and increased authority in practice areas in their specialties. The process of interprofessional collaboration is a continuum of collaboration that reflects levels of communication and action. Parallel communication. In parallel communication, each provider communicates with a patient independently with similar questions. Parallel functioning. Communication where more coordinated, but each professional has a separate intervention and a separate plan of care. An information exchange, that's a planned communication, but unilateral decision making and little collegiality. We're not really into that. Coordinate and consultation. Mid-range levels of collaboration seeking to maximize efficiency of their resources. Co-management and referral. Upper levels of collaboration will get together with providers, and the providers are responsible for their own aspects of care and direct patients to other providers when a problem beyond their initial provider's expertise. So this is kind of like when a PCP will refer a patient to a cardiologist or an upper-level endocrinologist. In continuance with the interprofessional collaboration, characteristics of effective interprofessional communication include common purpose and goals of identified at outset. So the patient wants to lose weight. Everybody's going to be on the same page. Hey, we need to get this guy to lose weight. We need to get this lady to lose weight. How are we going to do that? So clinical competence for each provider. The cardiologist be like, I'm not quite there yet. I don't know how to help them. The PCP's like, okay, I got this. Interprofessional competence. So this means that each professional needs to be competent in their own area. Humor helps, and trust. You got to trust who you're working with, or you don't value and respect their decisions, which is the next piece, valuing and respecting diverse and complementary knowledge. Processes associated with these characteristics include recurring interactions that develop connections, mutual respect among healthcare professionals. Be like, yeah, I always talk to this professional about this kind of issue. He's really good about that. I have a working relationship with them. Positive psychosocial and professional aspects. Patients and nurses have a greater sense of autonomy, and the patients are happier. The next piece we're going to talk about is conflict. Conflict prevention and management. Conflict occurs when diverse interests about significant issues or concerns among individuals, groups, or organizations prevent problem solving, or emotional opposition creates, distort, stifles effective communication. As a part of the work environment, it is normal to have conflict. It cannot be eliminated from an organization. You're always going to have some type of conflict, but it can be managed. Responses to conflict depend on nurse leadership skills and personal leadership skills of each individual and the situation. Although it's viewed as negative, conflict is actually a good thing and can impose better communication, stronger team relationships, and healthier changes. So for example, you guys might not agree on something, but then you can come to an understanding, oh, I get where they're coming from. And that conflict actually just helps you grow as a team. Types of conflict. Conflict can occur between individuals, between nurses and patients or family members, between nurses and other members of the healthcare team, within a unit, within a department, between units and departments, between multiple organizations, within units or teams, and between organizations in the community. So how do we manage conflict when it does occur? We want to effectively manage it by bringing up the issues that need to be addressed. They can result in a beneficial outcome for individuals, groups, and organizations. So we have to identify those issues first. If a nurse takes a position of avoidance or compromise or accommodation, it can lead to resentment. So if you avoid the situation, you might learn to lead to resent it. If you compromise, that compromise might not be beneficial to you either, or accommodation. So if you're accommodating one and can't accommodate another, that can cause a strife as well. And it becomes, you might end up resenting or ambivalency, have an ambivalence about your job. Anticipating that conflict will occur is probably being more prepared. It's going to happen, so we want to be prepared to manage it constructively. So a lot of these ways that we do that is the professional growth and development, your self-inventory tools, to recognize your self-awareness, just kind of like we did with diversity and culture. We want to be self-aware, and we need to know what our biases are. We need to know what our personal inquiries are, our personal views. So those are all important when managing conflict within the healthcare system. As a continuance of managing conflict, agencies must promote programs that they go beyond assertiveness training, conflict management, and collaborative processes. So they have to prove that they do this. So all your Cape Fear Valley or all of your other hospital organizational EPIC trainings or your yearly trainings, a lot of these come into respect with managing conflict in the healthcare system. Institution-wide programs emphasize respect, acknowledge communication, and for the sake of the patient safety, use non-disciplinary actions and approaches to resolve issues, model language and tactics that remove the barriers to conflict resolution. Examples of these are actually crucial conversations, crew resource management, team steps. I think you guys have heard of team steps before. So team steps is one of them, and the exchange. Next objective, chain of command. Okay, guys, you got to know this. Know in your handbook. Look in your student handbooks for these as well. Who do you report to if you have a problem? This is managing conflict. This is managing everything. Okay, you found a conflict. You can't resolve it. Who are you going to go talk to? Chain of command, the hierarchy within an organization. Authority and responsibility of individuals in an organization depend on their position in the chain of command. Authority is the power to command others, and direct their activities. Responsibility, being accountable for meeting personal and organizational objectives and performing required tasks. Your line of authority is the power to direct activities of subordinates in the organization. Your staff authority is the power to provide advice, support to employees or departments, but not assign tasks. Chain of command provides structure. Employees understand how to perform their tasks, understand the supervisory relationships within the organization, and structure for reporting the issues. So that means that we understand where we're at, we understand what to do if there's an issue, we understand who to go to. The nurse should always follow the chain of command. For students, ding, 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 the nursing instructor is the first link in your chain. Okay, anybody know who the next link is? I'm going to ask. Follow the chain of command. Failure to follow this chain of command is unprofessional, and it slows the resolution process, and it may result in a disciplinary action. So remember that. So before you skip rank, make sure that there's not a disciplinary action that will result in you skipping the rank, and it might delay the process of your results. Organizational charts depict formal hierarchy structures and relate responsibilities. Sometimes organizations will have that so you guys know who to talk to. It's kind of like in your handbook. We have a block for you so you know who to call, or you know how to go about your chain of command. Other models are more traditional and shared governance models. It flattens the organizational chart, and participants share ownership of the patient care issues and outcomes.